Wisconsin Institute of Functional Medicine. Hey, doctor.
Hi.
Great to see you again.
Thank you. Good
So
to be back.
we want to talk about breast cancer. How many women does breast cancer affect?
It's crazy. It's 1 in 8 women. So just think, 8 women easily. So 1 in 8.
Yeah, look around a room, and that's scary. Now, we talked earlier, you had a little scare this year.
I did. I'm very good about getting my mammograms every year, and all it took was 1 year, one little change, and I had to have that worked up. I'm happy to say everything's great, but yeah, it was just 1 year, one difference.
Kind of leads into that importance of screenings.
Yeah, screenings are so important. Right now, we're seeing breast cancer even younger women. So before it used to be 50 years old, now it's 40 years old. If you have an average risk, then you should have a mammogram and an exam.
Oh, wow. So we are here to talk a little bit about risk factors. Now, you told me there are some things that you can control and you can't. Maybe we can go through that.
Yeah, so let's talk about what you can't control. You can't control if you're born with genetics that predispose you to breast cancer. If you also have a first-degree relative who has breast cancer, you can't control that. When you start your menses or when you finish, you can't control when that happens, and that's exposure to estrogen. So there's some things, even if you have, like myself, have something that's not cancerous, but it's in breast tissue, or you have dense breast, that can predispose you to cancer.
And what can you control?
So many things. So there are good things that we can do every day. Simple things that we can do are eat more cruciferous vegetables, be physically active, 30 minutes, 5 days a week. Also to not smoke, limit your drinking. So they recommend 1, at the most 2 drinks a week. Those things predispose us to cancer, all cancers actually, but specifically breast cancer.
It comes down to a healthy and active lifestyle, doesn't it?
Yeah, everything in moderation.
Right. Now, you have a test that's super easy that can help kind of refine or reduce potential risks.
Correct. So a lot of women don't know that we can actually take your urine, so it's a dried urine sample. We can test it over 24 hours, and we can see how are you eliminating your estrogens. It actually goes through the liver and through the gut. So phase 1 and phase 2 are through the liver, and we can actually see which pathway you're going down, and we can modify those pathways. So just think you can start working on those risk factors if you know you're going down the wrong pathway.
I love that. So you can catch it before it starts.
Exactly.
Yeah, and because you believe so strongly in the screenings, you're offering a discount for people to come in and just get that test done, right?
Exactly. We just think it's so important, and most women are not aware that it's available to them. And like I said, it's a urine test, easy to do, 24 hours.
Yeah, no risk. Well, Dr. Tracy Page, thank you so much for helping us out.
Yeah, thank you.
And we want to thank you for watching too.